Good evening and welcome to Tonight Show with Mrs. Malam. That's me. I am so excited to be coming to you from my home tonight for this version of The Tonight Show. Ordinarily, if this were the actual Tonight Show with Jimmy Fallon, this would be the time when there would be some kind of a stand-up routine. As many of my students and pretty much my entire family has told me, I'm not really that funny. So I'm not going to be doing a stand-up routine for you tonight. However, I do have some other things that I would love to show you, including interviews, sketches, games, stupid dog tricks, all different kinds of things that I have been working on to keep myself mildly entertained during this time of staying at home. So I hope that you will sit back, relax, and just enjoy the show. Tonight's first guest on our very first episode of The Tonight Show with Mrs. Malam is Dr. Erin Ledford. Dr. Ledford and I went to college at the University of South Carolina, where we graduated in 2005. This is the first time that we have seen each other face to face in like a live interaction since we graduated. So it was a really fun time for me, and I hope that you're going to enjoy it just as much. Welcome to Dr. Erin Ledford. He's coming to us today from South Carolina. How are you? How's your family? Is everybody holding up okay?
Yeah, I mean, everybody's pretty bored and over it, but kind of just doing their part to to keep the virus at bay.
There'll be a whole bunch of people who want to like come out and actually be able to do something, and your office is a place where they can legitimately come.
See somebody that they haven't seen for the last month.
Yeah.
Exactly. Albeit with a mask.
They haven't been seeing anyone for the last month, right? Since they haven't been able to come see you.
Well, exactly.
You and I went to college together, but I had no idea at the time that you were intending to become an eye doctor. So tell me about your path. How did that happen?
It was an accident. Like a lot of people that are in undergrad, you have to declare something whenever you first get in, but it isn't necessarily what you want to do once you start finding yourself and have gone through a few years of basic classes. So somewhere around third year, super depressed, didn't really know what to do with myself, had changed my major like 3 times, and took a trip through the honors college at South Carolina to Chicago for like a theater appreciation class.
Okay.
And I thought, well, Chicago seemed like a pretty fun town. How do I get there? I'll stay in school, which is a terrible way to choose how to do something. But in the end, it worked out. Optometry school is one of the things that I had been kind of vaguely interested in, and it was a good fit. The Illinois College of Optometry is on the south side of Chicago, very close to where the White Sox Stadium is. So for 3 years, initially I was there, and then in your 4th year of optometry school, every 3 months you move somewhere else to get a different practice modality, different type of patient, working at like a VA hospital, working with pediatrics, working with contact lens specialties or advanced care for ocular disease and post-surgical management, that sort of thing. So after I did that and graduated, then I took on a residency, which we are not as optometrists required to do. But I wasn't sure if I wanted to teach or if I wanted to work in a VA hospital, and both of those do require you to have a residency. So I figured, what's one more year of school since I've already been in it, you know? I did that in New Jersey. I lived in North Jersey and worked there and in Manhattan. Stayed on as an associate for a couple of years and then moved back south to South Carolina. Completely different modality. Then I went from working at a 120 patients a day specialty clinic to working in a Walmart primary care facility. And vastly different, but it actually gave me time to myself, which was nice. I wasn't working 7 days a week anymore. Yeah, and now I've opened my own place.
All right, so what is the strangest thing you've ever seen in your practice? I mean, keeping all confidentiality as you must.
So anything that can happen to the body can happen to the eye. And probably the most disgusting thing I've ever seen is definitely crabs in the eye. Yes. So someone had their eye very close to an area that had pubic lice infestation, and it attached to their eyelashes and their eyebrow. Pretty disgusting.
Yes, that's very strange.
I wanted to bathe in fire after that, and that's happened multiple times now. But literally anything, anywhere on the body can happen in the eyes.
I didn't know that.
You weren't expecting that, were you?
All right, so as an optometrist, what's different about what you do than what, say, an ophthalmologist does?
The best way to describe it would be the difference between a primary care doctor versus a specialist that does surgery. I will never do surgeries. I do the primary care kind of stuff to diagnose things, to try and treat underlying problems until they get to a certain level, and then you pass them on to the specialist.
What advice do you have for students who just really do not want to wear their goggles?
That is the only advice. You must, in the lab, wear your goggles. Too many times I have had people come in that have had lye burns or acid burns in their eyes, and it ends up either causing partial blindness or total blindness of that eye, because it will scar the cornea so bad that they can't even have a transplant anymore. Bases are definitely worse than acids. Acids, both of them wash. Like while someone else calls for help, do not remove your eyes from an eye wash station for at least 15 minutes of straight flushing. And even then, that might not be long enough. As long as you can do it before you're able to get to see someone who can help, keep flushing. The other thing that goggles are important for in situations like that, we have a lot of steel mills around here and chemical plants. And along with the chemicals that are in the air, there'll be bits of metal and wood flying around, and those get stuck in the eye as well. So then now this is something I can do surgery-wise, is I can go in with my little drill and burr out the rust that starts to form on people's corneas. Within 3 hours of a metal fleck getting in there, it'll start to do that. So,
wait, did you say rust on a piece of metal in someone's eye?
In the eye, yeah. If somebody's grinding or if they're welding and a spark flies up and it has a bit of metal in it and it embeds on their eye, within 3 hours it will start to rust.
Wow. That's oxidation at its best right there.
For sure.
Holy cow. My students would tell you that the thing that they like the least about me is that I am constantly telling them to put away their phones and giving them things to do that you don't get to be on the computer for. Are you with the students or are you with me on that?
Well, while you're in the lab, you shouldn't be on your phone at all, for sure. That's just
agreed.
A precaution that needs to, like if you're looking at your phone, you're not looking at your burner, you're not looking at your glass, you're not looking at your experiment to see what sort of safety problems could happen. And if you're not aware of your surroundings, then injury is your own fault. As to on the computer screen, they're finding more and more that the longer you spend looking at any type of screen, be it a tablet, a phone, or a regular desktop, the blue light wavelengths that are coming out seem to be more and more related to not only worsening sleep patterns, but also the exacerbation of gene mutation that can cause macular degeneration or color deficiencies or the growth of cataracts sooner in life rather than later. So a lot of places are starting to recognize that and more offer, particularly when somebody's wearing glasses, a blue light filter, or on a lot of phones, I know my phone in particular, at a certain time will turn off the blue light that comes out. It's nice to have it in the day. It does make things more vibrant, but it tricks your brain and it tricks your pineal gland into keeping you awake for longer, so you don't sleep as well. And the more unrestful sleep you get, the less your body can heal, the less concentration you have when you're at work or at school, and just the more irritable you become in the long run. So even just for that, it's a good idea to put it away.
Since the switch to digital learning, I spend so much of my day staring at screens because this is how I'm talking to other people. It's how I'm teaching. Usually I'd be in front of a classroom. I wouldn't have a screen directly in front of my face, but now I don't know that I have spent, aside from when I'm sleeping, I think that I am maybe like no more than 3 feet away from a screen most of my day. So
Right.
What can we do to sort of mitigate that? Is there stuff that I can do while I still have to use a screen?
Absolutely. Yes. So if you're going to be on a screen for a long period of time, roughly every 20 minutes, stare at something as far away from you as you can. What that does is allows the muscles of the focusing system to relax so that they don't feel like they're in hyperdrive all the time. That will prevent eyes from becoming more nearsighted, because that is also something that's happening. The longer people stare at their screens, the more nearsighted they're becoming.
Oh, great.
We've really done it to ourselves, because essentially everything is done on screen time now. But that is a thing that they're finding, that it's scholastic myopia is one of the things that they're calling it. It used to be just for people that would read and read and read all the time in low lit light. But now the same thing is being shown to happen to people that are on their screens all day long. So every 20 minutes, stare at something for a minute as far away from you as you can. Roughly every hour or so, get up and walk away from the screen and then come back. Really the longest anyone should stare in one sitting would be about the length of a feature film. And then you need to get up and give your eyes a break.
All right, so binge watching 3 seasons of Game of Thrones in a row is a bad idea.
That's a terrible idea. That's great, but no, don't do that. That's one of those things. When you've done something like that and you get up, don't you just feel exhausted? Just all of
yes,
your
absolutely.
Yeah. It's your eyes wigging out. They want to have a break. They don't want to be so intently staring at a light source and at something that close and focused to it all the time.
Yeah, that's definitely, I'm not saying that I have personally binge watched that much television in a row, but I did consider the upcoming competition of watching all 25 hours of Harry Potter films for $1,000. Right? I was like, I can do that. That seems very reasonable. What advice would you give to, most of my students are freshmen, but I do have some upperclassmen. What life advice would you give to today's high school students?
Try a variety of different things. Just because you think you're good at one particular topic doesn't necessarily mean that's what you need to stick to, because there might be something else that you like better, or that you're even better at, that you just haven't given yourself the chance to experiment with. Not necessarily illegal things, but try different types of subjects, different types of hobbies, just to give yourself a broader spectrum of life. Because who you are now at 14 is not who you're going to be at 24. It's not who you're going to be 10 years later. And it's, your life constantly will change. Do not pigeonhole yourself into one idea of what you think other people want you to be. Yeah.
I like that. That's pretty awesome. Do you have a funny memory or story or something about me that you think that my students should know? Something that I probably might not right off the bat disclose to them about past me from when we knew each other 15 years ago.
It's been a long time.
It has.
I feel like the first time I met you, you were trying to give me like a diatribe about a Mary Higgins Clark book, and I didn't know who that was at the time.
Excellent.
And I mean, and you were living in Capstone.
Yes.
So you were one of the Capstone, we were the same level, but you were living in the only other dorm that had honors students, so we didn't really know y'all, and we were like, who are these fake honors kids that are living over here in this?
Honors? Oh no! Just when we weren't in Maxie.
This is ages ago. I mean, girl, we're old. Like,
it's strange because having like taught there and because we worked there, like I don't know, I was on campus all 4 years.
Yes. Yeah, so, I wasn't already for the last 3. So.
Yeah, me too. So I felt like that was my home, right? Like I lived there, I worked there, I went to school there. Most of my friends and I hung out there. Like it's just where we were. My memories of us hanging out were actually later after we were both working on campus.
Yeah.
So, but going out to a club and I'm dancing and I'm having fun with my friends and then randomly just being like, oh, hey, there's
Aaron. Too much clubbing. No, it was a good time.
I heard today that Yesterday's is closing.
Yeah, they're not, well, they're essentially they're done. I mean, with all of the stuff here with the pandemic.
I can legitimately remember the first time that I went to Yesterday's because my friend was like, this place is so good, you're gonna love it. And so we go down there, like we walk down Green Street, we're like, all right, cool. And I'm standing there in like the area waiting for it to be seated. And there's a big sign that says Yesterday's Specials. And I swear to you that I did not remember the name of the restaurant. And I looked up and I was like, what is the point of putting up a sign that says Yesterday's Specials on it?
That's phenomenal.
So that was my first time there. It was all right. Well, I don't want to keep you from being able to like schedule patients and do stuff like that, but I really appreciate this. There's a good chance my students are going to have more questions for you, but I can definitely like type those up and send them to you for later.
Sure, absolutely. Yep. And anything, remember, on the body can happen right here.
That's very scary and good advice.
Yeah. But it's great though, because I mean, like, there's so much stuff that I can tell on people that they don't even know about themselves yet. Like doing a dilated exam, nobody likes to be dilated, but to look at the retina, oftentimes, I mean, I can't even tell you how many times I've told someone that they have an impending stroke or really bad high blood pressure or diabetes that they didn't know about, and it'll all show up in the back of the eye. Like, it's important to do it. Nobody wants to, but it's the only way to look into the body without cutting you open.
How important is it? I know a lot of like my students who wear glasses, certainly I did not go for regular eye exams until I'd been having headaches for like a year.
Yeah.
And finally, my doctor was like, go to the eye doctor. And I was like, but I don't have any vision problems. He's like, go to the eye doctor anyway.
Exactly.
It's the right idea. So is an annual exam a thing that everyone should be doing, or does people who are at higher risk?
It's definitely, if you have a family history of some issue, of course, it's going to come up sooner probably rather than later. But everyone should be doing it, even if your vision is perfect. That's not the only thing we're looking at. We're looking at the health of the entire eye, which gives us insight into the health of the entire body. So just because somebody has 20/20 vision doesn't necessarily mean that they don't have glaucoma, which is a problem where the pressure in your eye is too high and it starts crushing the nerve to death. And by the time you lose any vision from it, it's too late. It's already damaged about 80% or 85% of your whole peripheral vision. So yeah, like it's a good thing to do. Usually if somebody's healthy, maybe every other year, but if you look at a dentist, dentists have done a very good job of telling people that twice a year you need to get your teeth cleaned. And Why is that any different? I mean, teeth you can replace. Your eyes, you can't go down on 5 and get a new pair of eyes. You know, like that doesn't exist.
Robot eyes, they're coming.
Maybe stem cell eye. That is in the works, but not yet. What's up, puppies?
All right, so this is Beckett. Beckett is very calm during these calls. The dog you're hearing in the background is Piper, who can't shut up to save her life. Yeah, but only when I'm on video conferencing. That's
well, good. Yeah, because you're not paying attention to them.
Exactly, because clearly the stay-at-home order was all about me spending as much time as possible loving on the dogs.
Yeah, my cats are over it.
They're like, please go home.
Go away. Yeah.
You're too much.
Why are you here?
This was awesome, by the way. Thank you so much.
It's really good to see you again.
Good to see you too. All right, talk to you later.
Bye.
All right, well, thank you so much for tuning in tonight. The interview was a little long, so I'm going to wrap it up here. But next episode, you can look forward to learning about stop motion videos and how to make paella, as well as some other secret surprises that I might have up my sleeves. I hope that you have had a wonderful evening. And if you have a special clip, something that you're interested in, something you've been doing for fun in your time that you'd like to contribute, just let me know. I really look forward to seeing you again soon. Have a good night.